Open enrollment is upon us, and for those who have Medicare, there are some big changes happening. Taking over the mic for PH Insight is my colleague Jaeger Spratt, and joining them will be Kim Everett, as well as the Chief Mission Officer for the PAN Foundation, Amy Niles. They'll share more information about the changes you should look forward to this open enrollment season. Let's get to it. Hi, welcome to PH Insights presented by the Pulmonary Hypertension Association. Join us as we delve into patient stories, healthcare updates, and the latest insights on pulmonary hypertension.
Hi, PH Insights listeners. I'm excited to be guest hosting today's episode. My name is Jaeger. I am PHA's Advocacy and Treatment Access Program Manager, and I've been with PHA for about 3 years now. So each fall, we like to give folks some pointers and reminders about this season with regards to open enrollment, which for most folks starts in October or in November. Open enrollment is when you have the opportunity to review your health insurance plan for the coming year, and you can make changes to your plan selection. So for some folks, they may expect that their healthcare needs are going to remain pretty consistent in the coming year. They may already have an insurance plan that's currently meeting those needs. So in those cases, it's probably not as important for folks to review their healthcare plan if that's the case. But in many cases, especially for people with chronic conditions and complex illnesses like pulmonary hypertension, taking the time each fall to review expected medical expenses, any upcoming tests or procedures that you're aware of, and reviewing prescription costs can all be really beneficial to prepare you for the new year. For people who buy individual insurance through an insurance marketplace like Healthcare.gov, the open enrollment dates this year are Friday, November 1st through December 15th. And enrollment after that date is certainly possible. It just means that your insurance would likely not kick in until later, like around February 1st, 2025, if you're post that December 15th date this year. And then for people with Medicare insurance, that open enrollment period starts Tuesday, October 15th and closes December 7th. There is also a grace period in the first 3 months of the new year. So if you have signed up for a Medicare Advantage plan, you are able to switch around to a new Advantage plan. Or if you had a doctor's appointment and discovered maybe it is actually better for you to be on original Medicare, you can revert back to original Medicare from Advantage up until March 31st of 2025. So those dates are really nothing new. However, there are some pretty significant updates for Medicare recipients, which I am very excited to get into with you all soon. But before we do that, I do want to introduce the first guest of this episode, Kim Everett from Wisconsin. I met Kim when she joined in the World PH Advocacy Day campaign back in May of this year, and we had a great conversation about her insurance experiences. Kim, I'm thrilled to welcome you onto the show. Thanks for joining us.
Thank you so much, Jaeger, for inviting me to the podcast. Talking about ongoing struggles with insurance and the cost of medications seems to have just gotten a little easier for me with the Medicare drug changes of the infrastructure bill. I've had autoimmune disease for over 40 years, which has started with immune thrombocytopenia, which is ITP, in 1983. Various treatments failed to induce remission from ITP or the other autoimmune issues that subsequently presented a challenge until 2007 when I had an experimental stem cell transplant for autoimmune disease. Unfortunately, the damage from the attacks on my body had been done, so I live with some ongoing health issues, one of them being PAH. ITP was relatively easy, but the 1990s started having fatigue and joint pain, facial rash, the typical lupus symptoms. And then in 2000, I started having blood clotting and was diagnosed with antiphospholipid antibody syndrome. After that came vasculitis, and in 2003, pulmonary arterial hypertension. So I've had PAH since 2003. Regardless of being treated with high-dose immune suppressant therapies, autoimmune disease just kept getting worse for me. For PAH, I was treated with calcium channel blockers, various immune suppressant therapies such as rituximab, cell 7 blood thinners, while still having low platelets, which resulted in bleeding and clotting concurrently. For 20 years, though, PAH remained stable, surprisingly, which was good for me. PAH was something I didn't actually worry too much about until recently. During COVID, I noticed an increase in shortness of breath, chest pain, and I attributed it to deconditioning since most of us were just sitting on our behinds in our homes. By early 2022, I continued to experience an increase in symptoms and had an echo that confirmed pulmonary pressures had increased. I've been in remission for ITP, APS, lupus since 2008, so that was a shock that PH seemed to be progressing. I'm currently being treated with ambristatin and calcium channel blockers and doing pretty well. pH pressures actually decreased with treatment, so I'm happy for that. I continue lupus medications, but am off all the other treatments for autoimmune disease and no blood thinners. So yay for me.
Yeah, it's an intense history. So I really appreciate you sharing that journey with us. I know that's, a lot of years and a lot of frustration that you just summed up there. Kim, if you could talk with us a little bit about some of the challenges that you had with finding insurance that would cover the medications and treatments that you need to deal with those conditions.
Oh, gosh, can I talk? Over 41 years with autoimmune disease, health insurance has always been a huge concern for our family. Treatments can be extremely expensive, similar to PAH, very expensive drugs. I used to get infusion therapies in the 80s and early 90s, which ultimately maxed out my husband's health insurance plan, which was covering me as I was self-employed or an independent contractor. He literally changed jobs, and I ended up seeking employment and left contract work I was doing. With the passing of the ACA, that lifetime cap was off our back, so I'm happy for that. But as you can see, it goes back far in regards to dealing with health insurance and trying to figure out, what's going to work for our family. After my stem cell transplant, I qualified for Medicare, and I decided to remain on Medicare and stay happily retired, I guess. But I was able to use my husband's insurance initially, which avoided the Medicare premiums for Part B. Eventually, my husband decided he was ready to retire, and we both entered the Medicare market. During open enrollment, we decided the traditional Medicare and a supplement plan, which also required a separate Medicare drug plan. We felt we needed the flexibility of traditional Medicare and paid the added expense of a supplement and a drug plan.
Yeah, thank you for laying that out. I know weighing those pros and cons between like original Medicare versus Advantage and trying to find the right combination of plans can be a major undertaking. It's, of course, going to be different for everybody, but I'm glad that you all were able to sort of settle on what was going to be the right fit. And I just want to quickly highlight for our listeners, if you are grappling with a similar choice and you want to learn more about your Medicare options, definitely head over to the insurance and treatment access section of PHA Classroom, which we're going to have a link to in this episode's description. You can check out a 4-part webinar series on Medicare that I did with Danielle Burkett and Lara Nowicki. We get into a lot of detail about the ins and outs of Medicare Advantage, Medigap insurance, all of that good stuff. You can also download the comprehensive FAQ document. That's from the Ask the Experts segment. That document sums up a lot of the information that we covered throughout the webinar, plus some questions that we didn't even have time to get to during the webinars. So we'll, I guess, flash forward a little bit to this year, and you had mentioned the infrastructure bill, which I think a little more formally is called the Inflation Reduction Act, which doesn't necessarily sound like it should have anything to do with healthcare, a bit misleadingly. But there is a pretty significant chunk of that bill that deals with Medicare and is, attempting to address the really challenging drug prices that way too many people in this country are having to deal with. So Kim, can you tell us just a little bit about how those changes have impacted you and the way that you approach your treatments and medications this year as opposed to in previous years?
Sure. Well, my medication and drug premium expenses were always more expensive than my husband's. I was once on an injectable blood thinner that was $2,000 a month. So budgeting for medications has been a 40-year endeavor. When Everett was prescribed, and we're both now retired on a fixed income, that out-of-pocket copay was scary. Thankfully, I did receive a grant to help pay for some of the expenses, but my Medicare Part D drug plan premium is well over $100 a month, plus my other medications to keep lupus in remission. When the Inflation Reduction Act lowered the out-of-pocket costs this year to $8,000, I had a tremendous feeling of relief. Honestly, I almost couldn't believe it. I kept thinking, I'm reading something wrong here. I'm missing something. But to my surprise, in April, I received my explanation of benefits from my Medicare Part D plan, and I have no more copays, plus no premium cost. Not only for the expense of ambristatin I take for PAH, but all of my medications are free. I've received several more explanation of benefits. It still blows my mind when I open and read them. I still can't believe after all these years of high medication costs, it's a great relief. I'm getting ready to spend the extra money pretty soon. We're going on a trip.
That's super exciting. I feel like that's one of those, you get that first explanation of benefits, you want to like frame it and put it on the wall. But yeah, I'm so glad to hear that something like that could really ease that challenge of budgeting for you and your husband. I think just hearing kind of how that has played out is super helpful for people to understand the impact of these changes that are, I would say, really quite historic. I don't think we've seen changes on this scale for Medicare in decades. And I understand that Medicare recipients can look forward to an even lower out-of-pocket cap in 2025. So I have invited PAN Foundation's Chief Mission Officer, Amy Niles, to come and talk with us about those changes. So thrilled to have Amy on with PH Insights. Amy, thank you for joining us.
Thank you so much for the opportunity to join you. I am Chief Mission Officer at the PAN Foundation. We are a national charitable foundation and healthcare advocacy organization with a mission to accelerate access to affordable, equitable healthcare. And we do that through providing financial assistance, advocating for patient-centric policy solutions, and providing education. I have been a patient advocate my entire career, started as a hospital administrator, and now working at the PAN Foundation.
That's awesome. Yeah, we're really glad to have your expertise here to kind of help us understand better what's going on with those Medicare changes.
And these changes are really, really important. Just by way of background, at PAN, we provide financial assistance to individuals who are underinsured to help them afford out-of-pocket costs for their prescription medications. In fact, one of the about 80 programs that we provide is for individuals living with pulmonary hypertension. A huge part of our mission at PAN is to advocate for policy solutions that will improve access to care. And the two Medicare reforms that are going into effect January 1st in 2025, these are reforms we have long advocated for at PAN, and now we're turning our attention to educating patients and healthcare providers about them.
Awesome.
The first is the Medicare Part D cap. In 2025, people on Medicare with standalone Part D plans and those who get prescription coverage through their Medicare Advantage plans will not pay more than $2,000 in out-of-pocket costs for their prescription medications. This is a huge step in the right direction. It's a huge reform for people on Medicare. It will be automatic. People on Medicare won't need to do anything to benefit from this reform. And I think this reform will be particularly helpful for individuals who historically have had to pay many thousands of dollars in out-of-pocket costs for their prescription medications.
Yeah, I know it's going to be so exciting for people in the pulmonary hypertension community. That's something that I hear basically every single day is how challenging the high drug costs are. So this is really like world changing for folks.
It is. And we know that those patients, have historically paid many thousands in out of pocket costs for medications. Those costs came down in 2024, but you're right. In 2025, having that cap is going to be so important for so many people living with serious illness. The second reform is a voluntary program that will be offered by all Part D plans. And that is the ability to opt into a program called the Medicare Prescription Payment Plan. And this plan, it is a mouthful, this
Yes.
plan will allow you to pay your drug costs monthly throughout the year. To participate, one will need to call their Part D plan or visit their website for next steps. Important change. If one participates in the Medicare prescription payment plan, they're not going to pay their prescription costs at the pharmacy counter anymore. That's a big change. Instead, they're going to get a bill on a monthly basis from their Part D plan, and they will be paying their plan for those drug costs on a monthly basis.
Yeah.
Yeah, they're getting two bills really from their Part D plan. They're getting their premium bill and they're getting their bill for prescription medications.
Yeah, that's it's definitely going to feel very odd, I think, for folks as they're getting used to that new program of just coming to the pharmacy and receiving the medication and then just leaving.
And exactly right. So that is definitely, it's a behavioral change, and it's something Medicare beneficiaries who opt in will just have to get used to.
Yeah. And I understand that also applies for like mail-in pharmacies as
It
well.
does. It does. It applies, to mail in as well. So, the payment plan may not be the right program for everyone. It's going to be really helpful for the patients we just spoke about, the individuals who historically have spent a lot of money out of pocket for their prescription costs, maybe $2,000 in the first 9 months, or maybe they have a prescription fill that is $600 or more, a very large amount.
I think that's unfortunately common in the
Yeah.
PH world. Yeah.
Exactly. We also know that if someone has very low income and assets, they may be eligible for the federal extra help program. We also refer to that program as the low income subsidy program. And if someone can benefit from that program, it really behooves them to enroll in that program and benefit from those resources, because at the end of the day, with extra help, they're going to spend very little, if anything, for their prescription medications. And it's a better option, if you will, than the Medicare prescription payment plan.
Gotcha.
So
that does make sense. And it's good that there are these sort of different levels of assistance that are available for folks who may need that. Literally, as the program is called, extra help.
yeah, and we know, unfortunately, that there are several million people in the country who are eligible for extra help but are not aware of it. So I think we're all trying to do our best to educate patients and healthcare providers about the extra help program.
Yeah. No, that's really good that we have that extra education component.
So as we think about open enrollment, which is right upon us, it is a perfect time to think about one's prescription medication needs and to look for the information from the plan about the Medicare prescription payment plan. For that plan, it is really best to enroll in the program just prior to the plan year or at the beginning of the plan year, because then the individual patient has more months, if you will, to spread their costs over the calendar year.
Right. That makes sense. If you like start in June, then you're only spreading it out over 6 months versus if you're able to start in January.
That's right. And, when I think about these two reforms, I like to just highlight that the Medicare Part D cap helps lower one's costs. especially the people who are used to spending a whole lot more than $2,000, while the Medicare prescription payment plan makes paying those costs more affordable from a budget perspective.
So those are some really positive sounding changes. Kim, can you talk to us about what those upcoming 2025 Medicare changes mean for your yearly budgeting and how you expect to impact your day-to-day life?
Sure. What it really blows my mind, and I know a lot of people probably aren't putting it all together yet. But with Amber Sutton having an out of pocket cost of $1,900 for me and my drug plan, I literally will have zero drug costs from February on for the entire year. All I can say is a big thank you for this Medicare drug plan change in limiting it to $2,000 annually. After 40 years and so many conversations, I now have no more conversations with my husband on how to budget my medication. There's like a little bit of a guilt trip when it comes to the fact that, that our life is limited because of, my lifelong need for expensive drugs. We'll have thousands of dollars to spend next year. And trust me, we're already planning on how to spend it. No worries about what's next. How do we afford an increase in my medications or his medications? He's not getting any younger.
Right.
We can budget 2,000 max much easier than the unknown out of pocket and premium cost before the Inflation Reduction Act. I can still apply for an assistance grant, but I won't be completely freaked out if for some reason I don't qualify or I need additional treatment for lupus. We won't burn through our retirement dollars anymore. So it means a lot because we wonder what happens in 10 years when we don't have any money left.
Yeah.
So
It's huge. No, and that is such a very real and terrifying thought for so many people of like it can feel impossible to plan for the future when you have conditions like pulmonary hypertension or, other complex, like, your autoimmune conditions and just trying to comprehend how you're going to find the money and to keep going with this for like you said, the next 10 years can be really daunting. So I'm really looking forward to all the benefits and changes that this is going to bring for so many people who've had that struggle for a long time. And I think especially for folks who are like approaching the Medicare age and preparing to be in retirement age, knowing that they have this bit of a safety net of that annual cap, I think is going to really, a game changer for a lot of people. So as long as you have a Part D plan, whether that Part D is coming original Medicare or if it's part of Care Advantage plan, either way, it applies, which I think is helpful for people. And thank you so much, Kim, for coming on here today. I think hearing, directly from someone who's really lived this experience of struggling with these drug costs and now having this massive relief will hopefully really bring it to life for people of just what a big deal these changes are. So I really appreciate you coming onto the podcast and sharing your story with everyone.
Well, it was my pleasure, Jaeger. I hope what I had to share is helpful to other people who are either first enrolling in Medicare or have, just questions about what happens with this limit on Medicare drugs. It's the first time doing a podcast, so this was kind of fun. So thank you for the opportunity to experience something new. I always like to learn something and do something different and new. So I really appreciate the opportunity.
Amazing. Well, yeah, this is actually my first time as well. So thanks for doing this with me. It was super fun. And I hope that everyone gets a lot of use out of this interview. And Amy, before we go, are there any other things that you would like to remind the listeners as we are heading into this open enrollment season, and especially with these new changes ahead?
I think there are a few things that are important to remember. One is simply take time to review plan options during open enrollment, which is October 15th through December 7th. Find a plan that best meets your needs. I think too many people often take a shortcut and just assume that their existing plan still works, continues to meet their needs, and it may, but I think it's worth reviewing the plan options. Also think about whether you should opt into the Medicare prescription payment plan, and if the answer is yes, try to do so before January 1st so that when this new program takes effect January 1st, you're able to spread your costs over that 12-month period. And for more information, there are some great resources out there. Certainly Medicare.gov is a place to turn for information, or you can
Absolutely.
call Medicare, 1-800-Medicare. At the PAN Foundation website, we have a section that's called Everything You Need to Know About Medicare Reforms. It's a great place to look for information.
I've been spending some time on that website recently. It's very helpful and very comprehensive.
Thank you. And for your listeners, that's panfoundation.org. And then finally, a great resource is the State Health Insurance Assistance Program, where people can actually get free personalized health insurance counseling. And that website is shiphelp.org. It's a great organization and a great resource.
Awesome. Thanks for those great reminders, Amy. And for any listeners who would like more resources to help navigate through open enrollment, definitely go through the insurance guide section of PHA's website. There's a ton of information there. And if you are feeling in need of some one-on-one assistance, I also want to highlight the case management service that Patient Advocate Foundation offers. Again, all of these resources that we've mentioned throughout the episode are going to be linked in this episode's description. All right, that's all I've got for you. Thank you all for listening to PH Insight. I hope this episode offered some good insights into open enrollment.
And thank you for listening to PH Insights presented by the Pulmonary Hypertension Association. Remember to subscribe and to join us every second and fourth Wednesday of the month for more valuable insight. Thank you for listening to this episode of PH Insights. We'd like to take a moment to thank our sponsors for their support of the PHA Connects program, which brings you the PH Insights podcast. Sponsors do not participate in the development of and do not endorse content of programming. For a list of our sponsors for 2024, please visit our website at phassociation.org/aboutph/sponsors. Thank you for listening.